any matters arising from them?
No matter arising from my perspective, they look accurate.
Yeah, they were quite extensive actually. Thank you to whoever wrote them. And yeah, so can we approve those as a correct record? Fantastic, that's a thumbs up from Charlotte, one from me as well, so thank you very much. And then do we have any questions from the public? I don't believe we do.
No,
Okay,
no questions.
Okay, all right. So then if we move on to our first substantive agenda item, which is the update on the JSNA, and I believe that's going to be Tanvi reporting. Is that right, Tanvi?
We actually have FAST here today who will be doing the presentation.
Oh, fantastic. Okay, all right. Welcome to the team from FAST, and over to you guys. Thank you.
Thank you. So, sorry, Jen, carry on.
It's okay, Andrew.
I was just going to say thank you. There are three of us here from FAST. We work as independent consultants within the overall framework of FAST. So I'm Andrew Rogers. I'm mainly an academic. I work at Manchester University, running Masters in Public Health and BSc programs in Public Health for most of my time, and then I'm a business consultant on the rest of the time. Jen?
Thanks, Andrew. My name is Jen Din. I'm a FAST associate, as Andrew said. My background is in commissioning public health in local authorities. Thank you. Nick, do you want to come in?
Thank you. Hi, everybody. My name's Nick Aldridge, also from FAST. And yeah, my background is in public health intelligence, both within national organisations and currently within a local authority setting.
So I think Great. Jen's going to take us through some slides, and then Nick and I will chip in as we go through. I just wanted to say that we're still at a relatively early stage in this process. So this is our first opportunity to come to the Health and Wellbeing Board and to get your steer. Okay, Jen?
Okay, so I hope everyone can now see the slides. As Andrew said, so this is just a progress update on the work that we're doing around the JSNA and the Health and Wellbeing Strategy Refresh for Bracknell Forest. So I thought we could start by going through very briefly what we've been commissioned to do. So FAST was commissioned to develop the foundations for a JSNA for Bracknell Forest, and as some of you might already know, but for those who don't know, JSNA is a process for looking at the current and future health needs of a local population, and it is used by the local system to plan and commission health and wellbeing services for the local authority area. And as part of that work that we're doing around the JSNA, we've been asked to identify 5 topic areas to start with, to undertake a deep dive within these topic areas. That would then involve highlighting what the needs are, what the health inequalities are locally, and also bringing together the evidence and the voices of local communities and lived experience, people with lived experience. Lastly, we have also been asked to support the Health and Wellbeing Strategy Refresh for the Health and Wellbeing Board. And to do this, this is basically where the Health and Wellbeing Board will set out their priorities and plans for improving the health and wellbeing of the residents using the intelligence from the JSNA, which would involve the deep dive areas and any existing intelligence that the council or the system already has, and also what the policy context is and what the partners and stakeholders are saying. So just to summarise what we're here for today, we would like to ask the Health and Wellbeing Board to note the progress of the work that we have done so far for the JSNA, following the process that we've done that's led us to identifying the areas for deep dive, and also the initial insights that we've gathered from stakeholders around the potential focus and structure for the health and wellbeing strategy, and then build on this, building on the insights that we've highlighted in this presentation and the report, to provide us a steer with regards to how they want the vision to look like and the strategic priorities. And lastly, we'd also like the Health and Wellbeing Board to support the work and endorse the work that we're doing across the system. That is simply to introduce the work that we're doing, so that people would know that we might come to them with various requests relating to data sets and engagement. So this slide is just a high-level overview of the process that we're doing for the 2 work streams that I talked about. And so we've grouped it in 3 stages, starting with the discovery phase, where we set out to identify the high-level needs across Bracknell Forest. And we did that by going through a rapid scan and analysis of indicators to come up with a short list of topic areas to look at. And also this is when we looked at the early scoping for the JSNA tool or platform and the health and wellbeing strategy and what that focus might be. And the next stage is the prioritization, which is where we are at now, or towards the tail end of it, hopefully. And this is where we worked with different stakeholders, spoke to different stakeholders to identify the topic areas for deep dive. And this is where we'll hopefully work with the Health and Wellbeing Board, or to get a steer from the Health and Wellbeing Board around the strategic priorities. And then following that, we'll go ahead and undertake the development of the JSNA and the platform and the health and wellbeing strategy. I just want to bring in Nick here to go through very briefly, talk through the methodology that we used to come up with a shortlist areas.
Thanks, Jen. So as Jen introduced in the first slide there, JSNA really is supposed to be outcome oriented and pragmatic. So we can't do deep dives into everything. So the purpose of this triage and prioritization process is to go from that really broad, rapid summary of needs right across the landscape, to try and start refining down to the areas where we can add the most value by doing those deep dives. So the methodology that we followed for doing that was, for the initial rapid stage, was to bring together hundreds of quantitative indicators, also existing reports, because there's already a lot of insight held within Bracknell Forest, and then further stakeholder interviews as well, and triangulate between all of those different routes into the prioritization process, to identify where issues were cropping up in more than one place. And we've called that on the slide there, we've called these triggers, that basically if there's a scenario where a specific topic is being flagged as indicators are getting worse, and we don't compare particularly well against neighbours, then that would be those multiple smoke alarms that would warrant looking a bit closer at that topic. Or maybe if there was one smoke alarm in the quantitative data and also stakeholders had been raising the same issue, again, it's that accumulation of multiple signs pointing to that topic. So by going through that process, we could refine down from a very long list of potential topics to a still long but shorter list that could then be scored using a standardized framework by stakeholders in a much more in-depth way.
Thank you, Nick. So as Nick said, we have narrowed down a large range of indicators from 30 different topic areas to just 9 candidate themes, which we took forward to the next stage. And this was reviewed by the working group and the wider stakeholders via an in-person workshop, which we held in January. And Nick mentioned that we use a standardized framework for the group to look at how the different criteria like prevalence, severity, preventability, how these all balance against the topic within the topic area. And as part of the engagement in the workshop, this is when we also asked stakeholders what their thoughts are around what the strategy should also focus on for the refresh. So I already talked about the purpose of the JSNA, and Nick mentioned it as well. So for this slide, maybe I just want to highlight the tool or the platform of the JSNA will be held, and our initial thoughts or plans for this would be that it will include at least a page for describing the population profile of Bracknell Forest and the change in structures, and then the initial health profiles for the 5 topic areas. And we say initial because this could potentially be added to in the future. And then a separate page for existing wider health insights that Bracknell Forest already holds, such as the PNA and the various health needs assessments that have been done recently. And I'm going to bring in Andrew to talk about this slide. Andrew.
Sorry, my microphone was off. Because time is very short, we need to keep this quite snappy. I'll just quickly work through these. So these are the areas, these 5 areas, which have looked, when we looked into the data, these are areas where compared with the rest of the region and UK as a whole, these are areas where Bracknell Forest is perhaps not performing too well, and the indicators are that it's getting worse. So this is why we think these are priorities for a deep dive. This is not necessarily saying that these are the strategies that you need to put in. This is just, we need to look into the data to understand it better than we're doing now. So we've got healthy weight, people with multiple disadvantages, loneliness and social isolation, children and young people's mental health, and frailty. So some of these things cross across each other, and of course some of them are very closely related to other priorities that we didn't think we needed a deep dive on. And I'll raise it here because it's likely to come up. Cardiovascular disease is not in the deep dive analysis. However, it's closely linked to healthy weight in any case. And we have to think about, well, what is it that you actually need to know at the moment? And it's had the healthy weight indicators, the ones that are really going to getting worse. Next slide, please, Jen. So back to Jen, quickly.
Sorry, I just saw the messages. So this is just a visual representation of the initial thinking around what the strategy should focus on, and this is based on the feedback that we received from different people that we spoke to, and very clearly there's a clear interest in organising it by the life course approach, and what you'll see here. What you'll see under each life stage are some of the health outcomes or health behaviour outcomes that the Health and Wellbeing Board could potentially focus their collective actions on, and what we're proposing is that these all would be underpinned by principles such as improving health literacy among the populations, developing joined-up person-centered systems, and building health-promoting environment. And I think this is the very Yeah,
Yeah,
so
I
this
th- I
is the
think
very
Council-
last slide.
Sorry, Jan, I think Councillor Writer suggested that the slides have already been shared, so people know the slides,
Okay.
and we should probably just
Okay.
take some questions at that point.
Sure. I'll stop sharing.
Thanks, Jim.
Yeah, sorry, I should have said this at the start of the meeting. I was just very conscious that I'd been late. Yeah, I mean, thank you. This is great. And obviously quite a lot of us were at the workshop as well. So it's really good to see the outcomes of this workshop and the slides. I give us another, 5-10 minutes to have opportunities for people to ask questions and to kind of understand the next steps of this kind of transformation of the JSNA. So I can see Charlotte's got a hand up, and then Nicola. Thank you.
Thanks all. It's a helpful run through. I think just for the board's wider context for the board's information, and we will be touching on this in the workshop that we're going to have after the board meeting. We discussed previously as a board our want to really be able to focus in and hone down on quite a small number of priorities, 2 to 3 priorities that we can really make and demonstrate impact on, and what is our collective benefit of coming together as senior leaders across Bracknell Forest in respect to health and wellbeing and health and social care. And what is it that we want to have a knowledge and understanding on in order to be able to do that, but against the backdrop of us as a board having a wider variety of statutory responsibilities and a wider scope to our remit as well. It is a bit of a tension between them focusing down onto some set priorities while still delivering our statutory responsibilities. And I think we can structure the health and wellbeing strategy and our vision as a board to enable us actually to do both. So when we're considering these priorities as a board, this is important for us to think about what is those deep dive, those 2 or 3 key priorities that we want to hone in and drive forward impact on, as opposed to the wider sponsorship or observing role that we might play in terms of our role in the wider system. So it was just to clarify that point as well. Thanks all.
Thank you. Nicola?
Yeah, really good presentation, and I like the clarity of those priority areas, incredibly helpful. Just a couple of comments from me. In terms of frailty and preventing frailty, actually postponing frailty is as important as preventing it. So we just need to make sure that underneath that heading, we realise it's not just about nobody getting it, it's about postponing the impact of it. And then one of the difficult things when you're working with PowerPoint presentations is you have boxes and it looks all really clear that things fit into one box. So I think being clear about how we manage interdependencies so that we're clear who's driving each of the boxes is important. So I'll give an example. So social isolation is a contributor to frailty in older people. So we just need to be clear. We're going to tackle social isolation for older adults in the socialisation box, or are we going to tackle it in the frailty box? And we just need to be clear, and there'll be multiple ones like that across all areas. So mapping, once we've got our boxes right, mapping the interdependencies and what's going to sit where will also be important.
Yeah, I agree entirely. And I also, obviously, the other end of that is children, young people and mental health, also tying in with loneliness and social isolation. So there's quite a lot of overlapping themes there. Grania?
Yeah, I just reflecting on what Charlotte was saying, and I think that those, should we say, themed areas, the ones that need to go across as well. So SEND, for example, we need to ensure that for our regulators, that when we're, even if we're doing the boxes, those 5 areas, that in the relevant areas we have mentioned looked after children in care, and also children with SEN needs. I think there's just something about us being clear about those included in the metrics and also outcomes for those. And so I'm completely in agreement with the approach being taken. The children, young people and mental health is a key one. I'm really, really pleased to see that in there because that's going to be threaded through everything that we're looking at. People with multiple complex or disadvantage, sorry, I haven't got it on screen at the moment. Again, in terms of presentation, we're seeing a lot of individuals who are presenting with a range of different needs. So it's interesting that's come through in the data from your analysis. So what we're able to do collectively then to address that, it's going to be interesting to see. It won't just be the usual partners, it'll also be TVP, etc. So in terms of that partnership approach, it's going to, when we're looking at what do we do, a broader range of partners will need to come in for some of those discussions.
Thank you, Charlotte. Do you want to just come in with what you've typed in the box?
Yeah, I just popped it in the box for time, but just to say, in developing this, we can also gain an understanding of what's being focused on elsewhere in the system. We've got an emerging population health unit for Thames Valley. That it's likely that will do a test and learn around CVD. So again, thinking about what is the role of the JSNA at place, and how does and give the place flavour. So for us, healthy weight, and how does this then feed that bigger ICB geography or other geographies that we work within, whether that's Thames Valley or Berkshire or whatever that looks like. So again, it's just making sure that what we're developing at a local place level is complementary to the bigger geographical footprints.
Yeah, agreed. Okay, thank you. Philip.
Lovely, thank you, Megan. I'm just wondering about that sort of life course approach to some of those themes that we're deep diving. I mean, obviously frailty would be an outlier there, but certainly social isolation, loneliness, mental health, healthy weight, and we may have different actions and different organisations that kind of hold those particular or lead those particular areas. So I'm just wondering if it would be worth building in that sort of life course approach to those deep dives too, as we start to take action around them. Thank you.
Great point. Thank you, Charlotte.
And just on that life course approach, just for the board's knowledge and benefit, that is the approach that's also been taken in Slough and the Royal Borough. So if we did go down that route of structuring it in that way, it would complement, it would align, it would potentially future-proof depending on direction of travel for local government moving forward as well. So that's an important consideration for us.
That's fantastic. Really good point, Philip. Thank you. Okay, that's great. Do we have any more questions on this? Martha.
Yeah, thanks ever so much. It was really helpful presentation, really interesting to see those themes come through, what those themes are. I was just wondering about thinking in the context of tackling inequalities as being one of our system priorities. And sort of our leading causes of death in Bracknell in terms of premature death. So as Charlotte said, the cardiovascular disease priority is a system one, so that might be dealt with elsewhere. But are we confident as a board that we've already got enough around the other leading causes of death, and whether or not we need to be paying particular attention to those? Thank you.
I don't know. Who would be able to answer that?
Shall I come back in on that? I think obviously the analysis and the modelling that FAST have been doing, that begins to take that into account. That's what's informed this prioritisation piece. We will certainly have a much clearer view because the JSNA in its entirety, yes, it will focus on these priority areas, but it'll also provide that overview piece. We've got the public health outcomes frameworks and other national data sets that we currently hold that indicate and give us those red flags as to where our need in terms of both morbidity, mortality, preventable mortality, early mortality, healthy life year, what is impacting actually on Bracknell Forest. So all of that will come in and displayed, but that has been taken into account in identifying these priority areas. So I don't think we've missed anything. we do need to do some work on making that accessible, and it will be included in the JSNA moving forward.
Fantastic, thank you. And also Nicola's put a comment in the box about frailty in younger adults. Andrew, you've got a minute. Sorry.
That's fine. I was just going to say thank you for all of those comments, because for me this is about where we're going to next with all of this. So in us looking into these priorities, we're then going to be asking the questions of, and what can we see in terms of evidence base so you can do something about all those. So some of those factors about what level of prevention are we talking about here? Are we talking about primary prevention? Are we talking about something stopping escalating? All of that will be coming at that stage when we start to look at what strategic responses you can do to these priorities. And we're keen to get involved in those discussions with you.
Okay, fantastic. Thank you so much. Thank you. Yeah, we're looking forward to the next stage. Nicola?
Sorry, Megan, there were quite a lot of priorities there, probably more than we can do in any one go. Are we going to go through a process of refining those further?
I think so.
I think we can have that for the strategy, but where are we going to start, I suppose?
Yeah, I think those 5 that were highlighted are over the course of the strategy. We'll come on to its life course, likely to be over a 10-year period, but we'll confirm that with time and discussion. And then, yes, what we will then do in terms of what Andrew's just mentioned is looking at what is within our gift and our control to act on now, what is going to be our drive priorities for the first 12 months, 2 years, and the sequencing as to what we're going to be doing when. Yeah.
Fantastic. Okay, guys, I think we need to move on to the next agenda point. And thank you so much to everyone from FAST. You're welcome to stay. If you want to stay for the rest of the meeting, you might find it interesting. So we're just going to move on now to the Child Death Overview Panel report. Is that right? And that's you, Charlotte.
It is me, yes.
Thank you.
I'm not entirely sure why it's me, but I will speak to it. I am briefed to speak to it. Apologies all, you haven't had a cover sheet for this. And this is an annual report that the Child Death Overview Panel produce. It does sit within our safeguarding partnership and the safeguarding side of the system. And so this is an example of one as a board that we need to observe. So moving forward, it will be reports like this that will come to the board for information. I don't propose to go through it in detail. The headlines are there. It's nicely laid out. It gives an overview as to what the overview panel has worked on over the last 12 months and the areas of focus from those reviews that they've undertaken over the last 12 months, what the focus needs to be moving forward. The board can be assured that this does sit and is being reviewed by our local partnership, safeguarding partnership. And unless there's any queries or questions or points of escalation that anybody wanted to raise to feed back to the safeguarding partnership, then there's nothing further to report.
Any questions? I just had a few technical questions. What's that? And I'll put these in an email, Charlotte, because I don't imagine you know them off the top of your head. I couldn't work out what our rate was in Berkshire per 100,000. So we saw those comparative rates for South East and the UK and England, or maybe the UK, but we didn't have a rate for a Berkshire. So it was quite hard to look at whether or not how our rates compared. And then obviously the concern that there's a very high death rate by ethnicity. But then if you read in a bit more, I think I understand where that's come from. And then there's a point, one of their recommendations is that East Berkshire explore options to recruit a child mortality bereavement nurse. And I just wondered, who would that sit with? Would that sit with the NHS?
And again, so those questions I couldn't answer today, but what we can, the two data ones we can certainly escalate to the analyst who sits within Slough, who's pulled that together. So that's we can take that back, and then we can follow up with the Child Death Overview Panel coordinator to ask the question specifically about that recommendation for that post.
Okay, brilliant. Thank you. Any more quick questions on the Child Death Overview report? No. Okay, fantastic. So we'll probably end up rushing through everything and wishing we'd spent more time on the JSNA, but never mind. Let's go on to, we've got the carer strategy, which is exciting. So this is, I think this is end of our first year of implementation, Sarah, is that right? So that's great. Brilliant. Okay, over to you.
Thanks very much, Councillor Ratt. So yes, as Councillor Ratt said, we published our all-age integrated carers strategy late 2024, and following its first year of implementation and driving forward to meet the priorities in the strategy, we've undertaken a thorough review of how we've achieved and how we've performed and how we've progressed following the first year of implementation. So I've brought for the board for the consideration the full carers progress report, and you'll see that I noted that the many achievements and successes we have been able to recognise is really reflective of a strong foundation of effective partnership working across the system, which includes health, our voluntary sector, and health and social care. But also really to note, the ongoing breadth and depth of responsive engagement we get from our carers in the community really helps to steer and inform what we're able to consider as achievements or to understand any barriers in implementation. So it's important to have these reviews and to understand where we are in the strategy. But it's important to continue to listen to our carers, and that's really the purpose of this report. The report itself is quite comprehensive. It outlines the methodology in terms of our approach that we undertook to, one, listen to carers, but review what the data was telling us and understand the quarterly reports that the Partnership Board oversee. We also listed out some of the key achievements, key activities, key achievements, and then also undertook to understand what actual impact that had for our carers, with a combination of what carers are telling us as well. We also noted in terms of transparency and honesty, some things didn't progress as well as we would have liked them to, but there's mitigation plans for all of those and they are progressing as we speak. So the actual report itself then goes into quite a lot of detail under each of the priority work streams. And the reason we brought that in is because there's so much work under each of those work streams. I think it's important to reflect it all. And the attached appendices are just evidencing some of the things we were referencing, like some of the engagement that we undertook and some of the work that was going on with the young carers. The public version, which is Appendix B to this report, is more succinct and slightly more palatable, and that's the one that we will publish for the public to see, and that's the one we'll go back out and feed back to carers, and it just tells the story in a lighter way as opposed to quite a comprehensive report. So really just wanted to share that with yourselves today, and reassure everyone that the work is ongoing and we will continue the cycle again and review our progress in our second year as well, and these reports do inform a refresh of the action plan as well and ensure our steer of direction is still on point. Grania?
Yeah, just briefly. So thank you, Sarah, and all of your colleagues and the steering group for the significant amount of work that's been undertaken over the past year. Firstly, creating the strategy, the action plan, the progress, and obviously the refreshed action plan. It's been significant, but we had a detailed discussion, number of details discussion recently, haven't we? And very impressed with the progress that we've been able to make already in the first year with everybody coming together. So so if you can convey everybody's thanks, that would be very much appreciated, because it's very much a system plan, isn't it, which is really positive to see. A system and all age.
Yes, yeah, thank you.
Brilliant, thank you. Nicola?
Yeah, I just wanted to recognise what a lot of progress has been made in this area over the last year and how it's touched all the partners of the Health and Wellbeing Boards, whether that's local authority or general practice. And I just wonder if there's lessons we can learn from this that we can then take into the other work that we're trying to do together? So was it because we had a clear strategy and plan? Was it because of the amount of time we committed to it? How did we have so much success in this in 12 months, where in some other areas we struggle to get as much traction and as much demonstrable improvement? So I just wondered if we could look at this specifically and see what we've learned from it to take into the other work that we do together.
Yeah, no, that's a really helpful question, actually, and I think there's multiple strands to the response. On the one hand, from a practical point of view, we absolutely knew there were areas that we needed to improve on, and work was started as part of business as usual, and that was reflected in the strategy. So some of the work was progressing at pace anyway. I think in terms of the carers strategy has, for me anyway, been kind of a flagship model of how we work with all our other joint strategic partnership work that comes into us, and it's very much a process. So one of the bits that we've learned a lot from was moving from a steering group overseeing the development of a strategy, and that's great with lots of co-production, and then that point where we then merge into a partnership board to oversee the implementation, and that was quite a tricky phase actually, and we're seeing that exact same trickiness as we move along with the autism strategy that we're working on, because then it moves from key partners contributing to it and developing it, then to actually owning some of the work and driving it forward. And that's when it does get a bit tricky, because often resource is very limited, and it creates more work, that is. So I think lots of learning has happened with this also, I think, in terms of our reporting. So if you recall, we did slowly set up the dashboard. It took a lot longer than we wanted, but now we've gone into other pieces of work right from the beginning with the expectation that key leads on this will need to understand the metrics that they're going to be reporting on. And I think it's a helpful and a friendly challenge to say, okay, if we're going to do this, what impact is it going to have, and how will we know? Because how are we measuring that impact? So I lean on this model that we've now formed quite a lot in other areas of work, but there are definite pressure points where it becomes quite tricky, and some partners all around the table need a bit more time to adjust and bring it into their business as usual work plan as well. So lots of different elements. But Nicola, I think one of the main things was we did know we needed to progress in some areas of work anyway. So whether we will see the same levels of activity going on in the second year remains to be seen, but we will still see progress towards the 5-year plan.
Excellent. Thank you, Sarah. Over to Charlotte. Thank you.
Thanks, Sarah. Such a great snapshot of so much work that's been undertaken over the last 12 months. So huge thanks. Just 3 points from me. I think the first piece of information actually was within the survey element of what you shared, was the use of technology and internet. And I think it was 6 individuals had reported using the refreshed internet site of the 100 odd that had completed the survey. And I think we really need to take that on board in terms of carers and the demographics of large groups of carers in how we support and how we offer information to them. And I was wondering as well, because we've obviously done the engagement through the survey, and you reported on focus groups for the young carers. Have we done any focus groups with different demographics, just to sort of really understand? Surveys are great, but they do put ideas in people's heads as they're filling them out, as opposed to really getting underneath what it is that carers of different demographics want and need.
Yeah. I'm happy to come in. Grania, did you want to come in on that, or should I?
Yeah, we talked about that, at least in part this morning, didn't we? About how do we, with limited resources, how do we have more of a community focus to the work that we do, so we can reach out to people in their communities, including the ones that we don't traditionally reach. So I think one of the challenges is about capacity, but equally being able to ensure that we're reaching everybody where they are existing in those communities. So there's something about how we collectively do that together, and how we utilise the limited resources in the context of our community strategy. We were arguing this morning for that point, and it's the same across whether it's dementia, whatever the topic areas are where we want to hear people's voices. How do we change or enhance what we've been doing, but within the context of the resources to do it. So just to reassure, we are having the conversation. It's about then going back to our partnerships to see then how do we do that and what do we need in order to do it? Because I think if we could do that collectively, it's not such a big burden on local authority resource, which was what some of the barriers might have been to achieving that. But it's point well made. Thank you.
No, thanks, Grania. And just to the technology one is an interesting one, because one of the challenges that when we went out with a much more focused survey this time to understand, and we did attend all the focus group, we attend all the carers groups and things like that. We do a bit of a roadshow. And one of the things that we found was quite challenging when trying to understand progress is, of course, when you reach out to carers, they're not necessarily the same carers that we reached out to before. So, you know, you can't, it's not actually comparable. What we are noticing with technology is that our demographics are changing a little bit. So, for example, and it is noted in the report, whereas before we had a cohort that really struggled with technology, with our carer support service over the last year, every single person that has signed up to receive support actually has an email address and is a little bit more technical savvy than the cohort that might have signed up last year. So we are seeing changes in those demographics. Also, what we need to understand is when we reach out, and we reach out broadly to every resident has the opportunity to respond, is not necessarily the ones that are responding that need the help, that don't need help. So what I'm trying to say in a muddled way is the ones that probably are quite technical savvy aren't even responding to the survey because they are able to access support themselves and manage it quite succinctly. So it is quite challenging when trying to understand progress, which is why we keep on reaching out and contacting, because we're not getting the same people answering the same questions all the time.
Fantastic, thanks both. And Grania, thanks. Your point on the communities strategy was my last point in terms of the offer, and if we can get that voice in, we might understand actually how to position the support, the facilitation. Does it always need to be support? And then again, when I was reflecting and going through what's been done, there's such a wealth of an offer. But with time and the shift in population and the growing aging population, there's going to be even more carers. And so that sustainability, which is, Grania, your point that you've made, actually, what does that look like moving forward? And that's that empowerment piece, that two-way conversation piece, to really understand that. So yeah, it's just adding to what you've said, really.
And just to supplement a little bit further, it's about that vision for the future, isn't it? About what do we expect our communities to have the knowledge of, the support to be able to share, to support themselves with, irrespective of the topic area. So how do we go about educating is the wrong word, but informing our communities about what's available, how to get access, because we've got some really good groups already. It's the deserts that I'm worried about, the areas where we don't have those supports and those communities where that doesn't exist. So I think just be reassured that is part of the intent, or needs to be part of our overall intent, irrespective of the topic. So if it's about children or adults with autism, for example, how do we get a broad range of knowledge about issues relating to autism, or indeed improving the accessibility of our services, so our services or services out there more appropriately meet the needs of all people? Those equality issues, the barriers, and how do we get that threaded and embedded into communities? So I think the community strategy, as you know, I'm a big fan, and being able to enact all of this through the community strategy and having that ambition, I think we've got a lot of positive work that we've already done, but a real opportunity to use the work within the communities as a solid delivery mechanism for that.
Okay, that's fantastic. Thank you. Yeah, no, it's all really exciting, Sarah. Really great to see, and Grania, to see such progress. And and as you say, I mean, these are all going to tie in, because there'll be stuff in the dementia strategy and the autism strategy which will overlap, won't they? So and the community. So it's really good that this has been such a successful piece of work, because it helps build on these future strategies as well. So it's fantastic to see. Okay, if there aren't any more questions, I think we'll move on to the youth strategy. And I think that's you, Audrey. Are you with us? Hello. Oh, can't hear you. No. No, and I can read your lips saying, can you hear me now? But it doesn't look like you've got your mic muted. You might need to come out and come back in or something. Or yeah. Is that Audrey's? She left us to come back in. Yeah, okay. Oh, yeah, sorry, I just read it now. Is there anyone else that's been working with Audrey on this strategy who might be able to start off?
So in terms of the strategy was developed and the date listed to actually we hadn't had a youth strategy for many years, and it was a collaborative and co-produced strategy involving young people at the heart of it. So it's a very thorough and comprehensive piece of work with the aims and ambitions clearly articulated in the strategy and the action plan, and a lot of time and energy and effort was spent in creating a plan that young people wanted, and they've been the co-production of that and including involvement into the delivery of the actions has been significant. In terms of the plan, it's right. I wanted Audrey, I'm talking for you because are you with us yet?
Can you hear me?
Yeah,
so
we can now. Wonderful.
Yeah,
so
we can go for it, Audrey.
Introduction on the background, so over to you on the details. So
yeah, so
Genesis are covered.
So the youth strategy was created by young people for young people and with a range of partners. And I'm asking the Health and Wellbeing Board to note the content of the report that demonstrates the actions and the progress against the action plan. And it demonstrates the impact that the strategy has had on young people, which is increased health, mental health and wellbeing, early identification of need, improving independence for children with young people with SEND, increased access to services for young people who don't traditionally access health services, increased youth provision for those who are marginalised or minoritised. For example, we have a youth group for our newly arrived communities from our Afghan young people. And we have been able to deliver against the action plan with young people helping to guide and to hold us to account in terms of the actions that we are delivering. So I'm asking the Health and Wellbeing Board, as we move into the final year of the strategy, to note the progress made against the action plan. And as we move into the final year, there is a national youth strategy that we will be reviewing the strategy with the view of creating a new strategy and aligning that with the national youth strategy. So we'll stop to see if there are any questions.
Fantastic. I've just got a quick question for you, Audrey. When you first brought this strategy to the council, we talked about trying to reach youth in the travelling communities, and I just wondered if there'd been any achievements there. I mean, overall, sorry, I should say before I ask that question, I should say it's fantastic and it's great to see all the progress, and it's and it's really it's exciting. I mean, and it's good also to hear about the fact that because it's quite 2 years is quite a short time for a strategy, and it's good to hear that your plans for the next strategy, which is great to hear about. My question was just really about engaging the travelling community and youth from the travelling community.
So we have done some outreach in the community to identify those. And sorry for the wording has escaped me. I didn't mean to put hard to reach young people, because we don't use that phrase. It's those young people that we tend not to engage with, and it's understand those. So there is work underway to identify the Roma and travelling community. That is some of the actions that we are still in progress.
Okay, fantastic. Thank you. I can see Nicola's got a hand up.
Yeah, I just wondered whether we were doing, in terms of targeted work, anything around looked after children who tend to have poorer health outcomes, both as children and then as adults, and whether we track that at all. As I'm just thinking, as part of our overall strategy to improve health and well-being of the population, whether that's a group that we should be looking at more closely.
There is extensive work done with the looked after cohort of children and young people. How this aligns with the work that's done in the youth strategy is that we have many of the groups for the looked after group actually meet at Bracken Walk Youth Hub. So that's how we bring them in. We bring them into the targeted youth support space. But there's lots of work being done by children's social care in this area, and we do align with that work by opening the space to the looked after children. But there is lots of work in terms of engagement, ensuring that young people who are in our care have access to a range of services. So this aligns with the work that children's social care are doing. But there is lots of work that children's social care are doing in that area.
And this may be a question for Charlotte as much as for you, Audrey, is whether we track, therefore, that the effort that we are putting into that particular group actually is showing improvements in their health outcomes over time. And Charlotte, whether that will be part of our strategy going forward.
What I can say is, before Charlotte comes in, there is lots of having seen the recent self-assessment for the ILACS inspection, I'm aware that the outcomes for children in our care are tracked. There are health assessments that are done on every child that's in our care. So I know that that is an area that is tracked and has lots and lots of oversight from children's social care. That area, because it's part of our statutory responsibilities, doesn't really fall within the youth strategy, but I am aware of that work being undertaken, especially around the health outcomes of children in our care.
Thank you. Charlotte.
Yeah, and just to add to that, that is the ambition with time, is to pull all of the performance monitoring type information that we hold, either whether that's within the local authority or health or wherever that sits, that it comes into the same space to drive that narrative within the JSNA. So yeah, picking up your point, Nicola, it sounds easy when you say it, but in reality it's much more challenging, and unfortunately the national indicators they're not as sensitive for us to be able to say we've done X and Y and therefore that's impacted on those nationally tracked indicators. But we do have the local proxy measures that will come into that space. So yeah, it's on the radar of something that we want to be able to do within the JSNA. And I was just going to add, Audrey, it's great. It looks really, it is so nice to look back on what's been achieved. I guess my point was moving forward, and that health and well-being piece was at the time set and is very sexual health orientated. It would be we were more than happy to lean in from a public health perspective for the forward look and the refresh of the strategy and the priorities. There's work that's going to be going on around substance misuse in particular, and it would be great for us to be able to feature that in that forward look, as well as some of the other area of work that we're doing in our children and young people from a public health perspective. So we've already talked about, as a board, having CYP, children and young people mental health, as one priority area for within the joint strategic needs assessment and the health and wellbeing strategy. It'd be great to play across and see what element of that can sit within the youth strategy as well.
Thank you. Absolutely. Thank you.
Okay, fantastic. Thank you. Okay, my screen's gone blank. I hope, can you all hear me? Hello?
Yeah, we can hear you.
Oh, you can, right, I can't, right, okay. That's fantastic. Any more questions on the youth strategy? Yeah, thank you from all of us. And just sorry, just quickly, Audrey, you said the new youth strategy, national youth strategy, is that about to come out, or has it just come out?
It's just been published, so we're just looking at that to see how what we can introduce locally. And there's an aim of 250 new youth centres that be open nationally, and there's a huge investment by central government. So we just need to look at, as we did with the statutory guidance around the youth service, look at how that aligns with the work that we're planning to do in Bracknell Forest and how we can implement the National Youth Strategy. So that's, I think it was published at least a month ago. Okay,
fantastic. All right, thank you so much. Thanks for that. Do we have any further updates from any other anyone else on this call? Is there any additional updates from anybody? You'll have to tell me if you've got your hand up, because my screen has literally frozen.
So Megan, it's Grania here.
Oh, hi.
Yeah, just to say, just to say that, really just to note formally that we secured outstanding in all domains for our inspection of local authority children's services. So that's happened during the last board, so that was notified. So I think we're the only ones in our footprint to have achieved that status, which is an improvement since the last inspection, which was equally outstanding, but we had one domain that was good.
I know it's unbelievable, isn't it? I mean, thank you so much to everyone who's worked on that, and it's and as you can imagine, Mary, leader of the council, is absolutely thrilled. So it's fantastic and really good to hear as well. So.
But just to supplement that point now, if for those who were present, we did push to be more ambitious as a partnership in terms of our corporate parenting strategy, and the corporate parenting strategy and action plan includes key activities and engagement with partners and health partners. So it is relevant and appropriate, because it's not just about the corporate parenting duty of council and council officers and members, and we've made it broader than that. So thank you for partners, and because that was the area that we improved.
That's great to hear. Fantastic, thank you. Has anyone else got their hand up? I'm sorry, my screen's frozen with Charlotte with her hand up from earlier, I think. No?
There's no other hands.
Okay, well, that's perfect. All right, well, thank you so much, everyone. I'm sorry it's all a bit rushed, but obviously we're about to go into the workshop now. So just remind me, Charlotte, do we come out of this meeting and then join a new one?
I think the invite, if I'm correct, is for the entire session. So what we will do is close this meeting and stop recording.